Knock knock.
Hello.
Hi, I'm just washing my hands. My name is Bianca. I'm a student nurse. I'm just going to be doing a head-to-toe exam on you for today, and then I'm going to provide you with some privacy. So today we're going to be doing a head-to-toe exam, which is just evaluating you from head to toe.
Okay.
And then, do you have any questions regarding the procedure?
I do not.
Okay. And then I'm making sure that that your bed is lowered, that you have your call light with you. There's no safety hazards for you or for the environment. I don't see any presence of tubes or lines or respiratory equipment that could be a safety hazard for you or for the environment. Can I have you verify your full name and date of birth for me, please?
Yeah, Catherine Valdez, 12/7/1996.
Perfect, and I'm just gonna confirm that with your wristband, and I do show that does match. So I'm gonna just ask you a couple of questions. How is your mood?
It's been good.
Any depression, anxiety?
No.
Any thoughts of suicide at all for you?
No, ma'am.
And then do you feel safe at home?
I do.
You do, okay. And then so at the same time, I'm just taking a look. My patient does look well groomed, does not look disheveled. Hygiene is really good. And then now I'm just going to ask you again, do you know what your name is?
Catherine Valdez.
And then do you know where we're at?
Yes, at the library.
And do you know what time it is?
About 7:30.
And do you know what we're gonna be doing today?
I had to toe assessment.
Perfect, so I am noting that the patient is alert and oriented times 4. And then do you mind if I just shine my light on
Go ahead.
in your eyes? Okay, so I'll just shine this eye, then your other eye. And then now I'm just gonna have you follow the tip of my pen if you don't mind.
Mm-hmm.
Okay, so I'm noting that the patient's pupils are equal, round, and reactive to light and accommodate. And now I'm just gonna have you grasp my hands, if you don't mind. I just wanna
Sure.
check your hand grasp. So hand grasp bilateral. We are both in equal in strength in both hands. And then now I'm just gonna do strength resistance of both your upper and lower extremities. So when I push up, if you don't mind pushing against that.
Okay.
So we're just gonna
I'm sorry.
no, it's okay. So up and then down, and then again for your feet. Down, perfect. So patient strength for upper and lower extremities are equal in strength and strength resistance. And then have you experienced any sleep patterns at all?
No, it's been normal.
No? And then any dizziness or headaches?
No, ma'am.
Okay, so now I'm just gonna touch your head, if you don't mind if I just assess your head.
Okay.
So now I'm just touching your head. I am just inspecting that you do have your hair is clean, and then the shape is round, and I don't see any masses or any wounds. Did you experience any pain at all while I'm touching you?
No.
No? And then I'm just gonna shine my light again
Mm-hmm.
in your eyes, if you don't mind if I just take a look again.
Sure.
Perfect. Looks good. So now, if you don't mind, I'm just going to pull your eyes down just so I can take a look at the sclera. So sclera is white and white. The sclera is white, no abnormal mucus or discharge. And then I am noticing that the mucous membranes are clear and colorless. So now I'm just gonna touch your ears. So I'm just gonna check both of them, and then please let me know if you experience any pain when I touch your ears. So I am taking a look. There's no abnormal wounds or abnormal discharge of this ear. And then I'm gonna take a look at this ear as well. Any pain at all here?
No.
And then no abnormal drainage or any wounds at all that I can see. And then now I'm just going to run my fingers, and please let me know if you can hear that on both sides, okay, at the same time?
Yes.
Perfect, all right. And then now I'm just gonna take a look at your nose, if you don't mind just looking up for me. So I'm just taking a look at your nose. So nose is midline, not deviated. Have you had any nose surgeries at all?
No, ma'am.
No nose surgeries, okay. And I took a look at the mucous membranes are pink, and then pink and moist. And then now I'm just gonna take a look at your mouth, if you don't mind just opening up your mouth for me and saying ah. So I'm taking a look at your mouth. Your mouth looks really good, pink and moist. Teeth are intact, so dentition is really good. And then tongue is midline. I don't see any bleeding of your gums. When I shined the bright light, did you experience any visual changes at all?
I did not.
Perfect, okay, so now we're just going to do your respiratory assessment. So I have taken a look, and then your breathing has not been labored the whole time that I've been assessing you. Have you experienced any shortness of breath at all?
I have not.
perfect. And then, so I'm taking a look that your skin color is appropriate, with your ethnicity for both upper and lower. And then I'm also inspecting you, anteriorly and posteriorly. And then I'm also gonna take a look at your trachea. So if you don't mind just taking a look.
Sure.
Up, thank you. So I'm taking a look that your trachea is midline and not deviated. I'm also, I did take a look that your AP to T is 1 to 2.
Okay.
And then, so now I'm just gonna auscultate the anterior and posterior lungs. So I'm just going to listen to your anterior lungs really quick.
Okay.
And then I'll just have you turn around for me, please.
There you go.
Okay. So when I listened, I did not hear any wheezing or any crackles. And did I ask you if you experienced any shortness of breath?
No shortness of breath.
Okay, perfect. And now we're gonna go ahead and do the cardiac assessment.
Okay.
So I'm just gonna listen to the 4 landmarks,
Okay.
and then have you experienced like any chest pain or any shortness of breath at all?
No chest pain.
Okay. So now I'm just going to listen.
Okay.
So I'm just gonna listen here. We can do the aortic, pulmonic, tricuspid, and then the mitral. And then at the mitral valve, I will be listening to the apical pulse for a full 60 seconds. Okay. And then I was able to hear S1 and S2, and then I was not able to hear any additional abnormal sounds at all.
Okay.
So now I'm just gonna feel your radial pulses. So let me feel that really quick. So radial pulses bilaterally are equal in strength and rhythm. Now I'm just going to feel for your radial pulses for your lower extremities. So radial pulses for your lower extremities are equal in strength and in rhythm bilaterally. And then now I'm just going to check for your capillary refill.
Okay.
So let me just take a look and I'll have you turn your finger up. Perfect. So capillary refill for your upper extremities did come back within less than 3 seconds. Now I'm going to feel for the capillary refill on your lower extremities, and it has come back within less than 3 seconds as well. So I'm also assessing your the temperature of your skin. The temperature is warm, not too hot, not too cold. So I am feeling, and it does feel really good, just warm, not too hot, not too cold. I've been assessing for any signs of edema for upper and lower extremities, and I did not notice any edema at all. So now I'm just gonna inspect your abdomen if you don't mind. And then so I am noting the shape. The shape is flat and not distended. So now if you don't mind, I'm just going to listen to the 4 quadrants.
Okay.
Perfect. And then I did not hear any hyper or hypo sounds at all. And now I'm just going to palpate your bladder, and then I'll palpate the abdomen as well. Okay. And please let me know if you experience any pain.
No pain.
Okay. And then now I'm palpating the bladder as well. And then I just wanted to ask you, have you experienced any changes in appetite at all?
No.
Any nausea, vomiting, diarrhea?
No, ma'am.
And then when was your last bowel movement?
It was a few hours ago.
A few hours ago. And then any bladder concerns, like with any pain with urinating, odor in your urine, difficulty urinating, or any unexpected discharge?
No.
Okay, perfect. So now I'm just gonna have you stand up if you don't mind.
Okay.
And then we're just gonna do some movements for range of motion for the upper and lower extremities. So if you could just do the same movements that I'm doing.
Okay.
So just for your right arm, just extend forward to the side and back. And then we'll just do the same for your other arm. So
Okay.
forward, side, and then back. And we'll do the exact same movements for your legs.
Okay.
So forward, side, and then back. And then last leg, forward, side, and then back. Any pain at all with that?
No, ma'am.
Perfect, and then I'll just have you walk forward and then back, just because I want to assess your gait. Okay, so I am noticing that my patient's gait is equal, equally distributed in weight. And then now I'm just going to, I'll just have you touch your toes if you don't mind. So as I'm taking a look at your curvature is, I'm not noticing any kyphosis, lordosis, or scoliosis at all. And then now I'm just going to, I can have you have a seat,
Okay.
if you don't mind, and then I'm going to assess do the strength test again.
Okay.
So when I push down, if you just want to push up
Okay.
for both upper and lower extremities. So that is good, perfect. And then we'll do your feet. Perfect, so strength in upper and lower extremities is equal and bilateral for both upper and lower extremities. So now I'm just going to assess your skin.
Okay.
So if you don't mind if I just touch your skin, and I'm just gonna pinch. So your skin turgor did come back within less than 3 seconds, which is a good sign of hydration.
Perfect.
I have also taken a look at your moisture. Your moisture is moist and not too moist, but not dry either for both upper and lower extremities. I am taking a look at your skin color. Your skin color is appropriate for your ethnicity. Your temperature, I was feeling your temperature. Your temperature is warm, not too hot, not too cold. Have you experienced any itching of the skin or irritation at all?
No.
I've also, the whole time I've been assessing, I've been looking for any scars, rashes, lesions, wounds of your skin. I did not notice any of that. So now this concludes the assessment, the full head to toe assessment. Do you have any questions at all?
I do not.
Perfect. So then I would just wash my hands. I would make sure that you're in a safe, comfortable position, that you have your call light with you, and that your bed is lowered. And then I'm just gonna wash my hands, and I'm gonna provide you with some privacy, and then I'm gonna document.
Perfect.
Okay?